Hello everyone, welcome to sqadia.com. This is Dr. Sana Khan, and today we're going to discuss scapula and its anatomy. We have been discussing about different anatomical structures, and we also talk about the axial and appendicular skeleton, and we also talk about the shoulder girdle. So one important thing to know here is the scapula is one of the bone which is making up a shoulder girdle. The clavicle and the scapula, they are a part of the axial skeleton, and they're responsible for detachment of different muscles, and they're like a connection between an axial and appendicular skeleton. So we'll be talking about scapular anatomy, the important structures, surfaces, borders, and the muscular attachments, and obviously the clinical implication of scapular fractures, and what is the relationship of scapula with the impingement syndromes and rotator cuff tendonitis. And then we'll be talking about the glenohumeral mechanisms, which is one of the most important mechanism in the formation of the shoulder joint, and there are movements which are responsible for a free movement of the arm and the shoulder joint. So let's just start today. So basically, when you talk about scapula, you should know that it's a flat bone, which is basically triangular in shape. We talk about the clavicle. Clavicle was also one of the flat, long bones, but the scapula is a flat, triangular bone. And when we talk about different surfaces and the borders and the angles, one thing to remember here that scapula has got two surfaces, which is the anterior and the posterior surface. Then it has got three borders, which are the medial border, the superior border, and the lateral border. And then the three angles, which are basically superior, lateral, and the inferior angle. Okay, so when you talk about the the important structures which are making the glenohumeral joint, or which are making the acromioclavicular joint, the scapula has different important structures, like the spine of the scapula, the lateral end of the spine is actually making up the acromion process, which attaches itself to the acromial end of the clavicle, and it's actually making a acromioclavicular joint. On the other side, there is the glenoid cavity on the medial end of the scapula, and responsible for the formation of the glenohumeral joint, which is responsible for the fitting of the head of the humerus into the glenoid cavity, and it's making up a shoulder joint, which is responsible for very important movements on the upper limb. Okay, so if you could see here on your screen, this is actually the scapula, and this is the anterior view. Okay, so you can see the anterior surface, or you can see the ventral surface. The anterior surface of the scapula is called as the ventral surface, or the posterior surface of the scapula, which is towards the vertebral column, it's actually called as the dorsal surface or the posterior surface. You can use these interchangeably. Okay, so here is the clavicle, this is scapula, and this is humerus. So these bones articulate with each other, and they form a very important joint, which is a shoulder joint. And there are important anastomosis and important structures and important nerves and very, very important muscles. Not only the muscles of the upper limb, the extrinsic muscles or the intrinsic muscles, but also there are important muscles which are the rotator cuff muscles, and they're responsible for the rotation of the shoulder joint. One thing to know here is we have a hip joint and we have the shoulder joint, which both ball and socket joints. But the important thing to know here is the shoulder joint has got important free movements, okay, the full rotational movement, the circumduction, the medial rotation, the lateral rotation. So these movements are only possible because of the important articulation with the glenoid cavity of the scapula. So you can see actually the articulation here. This is the acromial, or you can say the acromial process of the scapula, which is usually on the posterior surface. And let's make a hook, like the spine is actually making up the hook. And to the lateral border is making up the acromion process, and this acromion process is attaching to the clavicle. You can see here, this is the clavicular bone, and the clavicle, the lateral end of the clavicle is attaching to the acromion process of the scapula, making up important acromioclavicular joint. Then you have the another lateral border, you can say. In the lateral border, you have a glenoid cavity or a glenoid surface of the scapula, and the head of the humerus. Let's suppose this is the glenoid surface or cavity of the scapula, and this is the head of the humerus, and it fits into this glenoid cavity, and it's responsible for the formation or articulation of the shoulder joint. Okay, then you have the inferior angle and the medial border. I'll be discussing in detail about the borders and the surfaces. And then you have this whole of the axial skeleton in the center. Okay, so when you talk about the scapula, it usually the extent starts from the second rib, and it is continuous to the seventh rib. And another important thing is that it's actually located at the back, where you can say it's on the posterior surface. It's related more to the vertebral column. So you can see here that this is actually the whole of the rib cage, the ribs, and the costal cartilages. And then you have at the back of this costal the whole of the rib cage, the scapula at the posterior surface. And this is making up, scapulothoracic joint, and then glenohumeral joint, and then you have acromioclavicular joint, and responsible for the shoulder joint movements. Okay, so you have basically these whole of the axial skeleton, which is giving or providing a attachment to the different limbs, and connecting the pendicular and the axial skeleton. To remember here is the scapula begins its ossification in the second month of the fetal life. Okay, and usually scapula has got different ossification centers. Okay, it has got 7 ossification centers. So one is in the spine of scapula, 2 in the coracoid process, 2 on the obviously 2 on the acromion process, and then 1 in the medial border and 1 on the posterior surface. So actually what you need to remember is that we talk about the clavicle that has got 2 ossification centers, right? But scapula has got 7 ossification centers. And every part has got different ossification center. Some are cartilaginous, some has got end-condyle ossification, and some has the membranous ossification. To remember here is most of the time the parts like the spine, the acromion, the coracoid, they are thick. They're usually thickest, and the rest of the scapula, like the anterior surface, it's actually the thinnest. And usually when you talk about the configuration, or it's a cancellous bone, and it's all in a compact a spongy bone and a compact bone, and some of the areas are thicker and some of the areas are thinner, like the spine of the scapula, the acromion, the coracoid process, they're all thick. The rest of the fossa, like the subscapular fossa and some of the parts of the supine and infraspinous fossa, they are actually thinnest in structure. So overall, what you need to remember is that scapula is one of the most important bone, which is forming a shoulder girdle along with the clavicle, and its articulation is very important, which is the acromioclavicular joint, the acromion process of the scapula. It articulates here with the acromion end of the clavicle, making up the acromioclavicular joint. And clinically, acromioclavicular dislocations, they need to be addressed. Then you have a glenohumeral joint. This a little bit about the glenohumeral joint is, this is the glenoid cavity of the scapula, and it's forming articulation with the head of the humerus. Okay, the head actually fits into the glenoid cavity. Now, usually, when the shoulder joint rotates, there's some degree of rotation at the scapula. Okay, so let's suppose if there's an abduction of the arm. Okay, so this is like abducting the arm. I'm moving your arm away from the body like this. So this is abduction of the arm. So when you're abducting your arm like this, okay, let's suppose I am abducting my arm to 3 degrees. Okay, so 2 degrees of the rotation is at the shoulder joint and 1 degree is at the scapula. Okay, so remember that whenever there is a rotation at the shoulder joint, there's some of the rotation at the scapula as well. And the important part of the scapula, which is actually responsible for this glenohumeral mechanisms, is the glenoid labrum, the glenoid cavity of the scapula. Then, when you talk about the structural anatomy of the scapula, one thing to remember are the surfaces, borders, and the angles. So remember, the scapula has got 2 surfaces, anterior posterior surface, 3 angles, superior angle, inferior angle, and lateral angle, and 3 borders, superior border, lateral border, and medial border. And they're very important structures, a group of the muscles like the extrinsic muscles and intrinsic muscles, and then you have some of the rotational muscles. They are actually attaching to the scapula, and if there is injury to any one of the muscles, there would be some of the pathology with the scapula, and like if the fractures of the scapula, they are, although they're very uncommon. Why? Because it's usually at the back. The scapula is on the posterior surface or at the back. Okay, so whenever you're suspecting a scapular fracture, remember that there is a possibility you will suspect that there's a severe chest trauma, and the mechanism of injury would be a crash injury or a victim which is crushed by a high-speed vehicle, right? So that exactly is the significance of the scapular fractures. We'll be talking in detail, but for now, you should remember that scapula is extending from 2nd to 7th rib, and it's located posteriorly along with the vertebral column, and it's important part of the shoulder girdle, and it's also making important articulations like the acromioclavicular and the glenohumeral joints, and also some of the scapulothoracic scapulothoracic articulation as well, just like shown at the back. Okay, so glenohumeral, acromioclavicular, and then you have the scapulothoracic joint, and whole of the scapula is extending from 2nd to 7th rib.